Pick's disease is a less common dementia than Alzheimer's disease, but shares some important characteristics with it. Alzheimer's disease and Pick's disease are both tauopathies. In other words, tau is the abnormal protein that accumulates in cells. Pick's disease is the fourth most common cause of dementia, but in under 65-year-olds it is the second most common cause of dementia. Overall, approximately 10 to 15% of patients with dementia may have features suggesting Pick's disease. There are familial forms linked to chromosome 17, and they are more common in people of Scandinavian origin, where it makes up as much as 17% of dementias. Unlike Alzheimer's disease, more men than women may be affected, and it affects a younger age group than Alzheimer's disease, with a peak incidence between age 55 and 65. Pick's disease causes frontotemporal lobar degeneration. Its symptoms include loss of speech and dementia. The defining characteristic of the disease is the buildup of tau proteins in neurons, accumulating into silver-staining spherical aggregations known as Pick bodies. Pick's disease is characterized by severe atrophy, neuronal loss and gliosis. Microscopically, the characteristic features are Pick cells, which are ballooned neurons, and Pick bodies. These are found disproportionately in the frontal. Here is a normal brain. The areas circled illustrate the areas most severely affected by Pick's disease. In the frontal cortex, the area that controls social skills, decision-making and personality, the language naming area and the language understanding area. This is a brain with Pick's disease. Notice the very severe frontal atrophy. The gyri are often described as being knife-like because they are so thin. The occipital gyri are relatively preserved. Pick bodies can be quite hard to see in cells, but there is an immunohistochemical stain for tau, which shows them up well.